Exercise 1 is sideline hip abduction. So the idea of this exercise is to make the muscles at the side of your hip work a little bit better. So what I want you to be is in side line with the affected side up, pillar between your legs, shoulder, hip and ankle level. First part I want you to do is stack the hip away, squeeze the buttock, and I want you to lift the leg 3 inch, and you're going to try and hold that position for 30 seconds. The aim of this is to build this up to 60 seconds, and I want you to try and repeat this 4 to 5 times. Exercise 2 is what's called a hip bridge. So you start position, you're lying on your back, and I want you to bring your heels back as far as you can, both sides. Next part of the exercise, what I want you to do is gently push down through your heels, and I want you to lift your bum up off the bed, not too high. Try and hold this exercise for 30 seconds, and then slowly peel down, and I want you to repeat this 4 to 5 times. Exercise number 3 is a single leg stand. So first point, so you stood on the affected leg, which in this case is the left side. I want you to squeeze the buttock on the left side. The key parts of the exercise is the pelvis is level, and you're going to try and hold this for 30 seconds and build this up to 1 minute. Some little cheat points to be aware of. The first one is a hip drop. So we see the drop on this side of the hip, which will load the tendons here. And then the second cheat point to be aware of is a shift towards the hip. Again, this will aggravate the pain. So what we're looking for is hip stacked, nice and level with a bum squeeze. 30-second holds to build that up to 1 minute. So exercise number 4 is sit to stand, or often referred to as free squat. So you start position in sitting, close to the edge of the chair, feet hip distance apart. I want you to gently push down through your feet and come from sitting to standing, nice and slowly. And then I want you to slowly come down, bringing your bum to the chair. I want you to repeat this between 10 to 15 times and relax. When performing this exercise, avoid the following. And as you see clearly, when you're sitting to standing, the knees are rolling in. Again, this will load the tendons and actually make your pain worse. Exercise 5 is a step up. So if the right leg is a symptomatic leg, I want you to put the right leg on the step. I want you to step up, bringing the hip over the knee, keep the right leg on, and bring the left leg down. And I want you to repeat this exercise 10 to 15 times. A few points to be aware of with this exercise. The first point is the position of the knee. So as you step up, I want you to try and avoid this. And in this position we can see the knee rolling across the big toe. Again, that will be loading the tendons at the side of your hip. The second thing to be aware of is the position of the pelvis. So as you step up, I want you to be aware of the opposite hip hitching. Ideally, the pelvis should be nice and level. Massage can help reduce the sensitivity and also the pain around the hip muscles. An easy way to do this is either with your elbow or with a small tennis ball in a sock. If you're using the elbow, you need a partner, and what you want to do is find a painful spot at the side of your hip. Maintain a downward pressure. Maintain this for about 30 to 40 seconds until the pain diminishes. Take that away and then repeat around certain spots around the bum. Sleep is often a big problem with lateral hip pain. A good position to help sleep is lying with the affected side uppermost. Place a pillow between both knees, and the idea of this position is to stop stretch through the upper tendon. An alternate position, if people struggle to lie on their side, is to lie on your back with a pillow between the legs. The idea of this position and the pillow is to stop the knee coming across the body, which again puts pressure on the side of the bum muscles.